Hi, Dr. Baumholtz, Baumholtz Plastic Surgery, and today I want to talk about management of the under chin and neck area. It's a pretty common question that we get asked here in the practice, and I've kind of outlined some things, and let's just talk about them for a minute. And I set this up to be a comparison between Kybella and liposuction. These are two treatment modalities that we have here in the office, and then down here I'm going to compare the Kybella to either a cool method or a hot method, and suffice to say, we'll just, or for the purpose of the video, we'll just make it, either minimally invasive or non-invasive versus the surgical side. Okay, for Kybella. Kybella is a synthetically derived chemical similar to what happens in our own gallbladder, and the gallbladder's function, among other things, is to squirt out this stuff when we eat food that helps digest fat. So the synthetic version, manufactured under the name Kybella, is used to melt fat where it is injected. And it's done in an office setting, and it typically requires 3 treatments, sometimes more, but 3 treatments. Each treatment will involve a period of some swelling and perhaps some bruising, although swelling is more common than bruising. And the swelling recedes over the course of a few days to a few weeks, depending on how aggressive your body responds to the Kybella. It does melt fat, pure, plain, and simple. It's typically good for smaller areas, so let's say, in this region, but we also use it in other areas. We'll make the disclaimer, we'll say off-label, but other areas, and again, it melts fat, so we can use it anywhere that fat would be, but typically maybe here in the front side of the armpit for gals as they get into bathing suit weather. They don't like that little bit there, sometimes around the knee, the inside of the knee. They don't like that little ball of fat, and so we can use Kybella to melt those areas or improve those areas. Let's compare that to the surgical procedure, liposuction. Liposuction has been around for a long time in the right hands with the right training. It's a very safe procedure. There are some risks, of course, but overall very safe procedure. It's going to be able to tackle a much larger area, the whole neck, for example, or neck and other places in one setting. Of course, there are small incisions that have to be used, and we're taking a big metal stick and placing it under the neck, which is where the wrists will come in. Of course, afterwards there's swelling and bruising, but once you're over that hurdle, you will see the final effect of liposuction in about 3 months. Now, the counterpoint, or the other thing that I make patients aware of very frequently, is oftentimes if there is a fat issue, we need to pay close attention to a skin issue. So for example, if you have hanging skin with fat and I remove the fat, I will worsen the hanging skin. If you've got a lot of fat and I remove all of the fat, I will likely give you hanging skin by nature of the fact that we've emptied out the content behind the skin and now the skin just hangs. If that's the case, if that's what you see in the mirror, we will likely need to talk about not so much liposuction or any of these modalities, but rather a face and a neck lift as we need based on what your desired goals are. I hope that helps answer some questions. If you'd like to know more, come visit us at Baumholtz Plastic Surgery. Thanks very much.